Ask who invented surgery, and most people will name a European. Centuries later, that answer is wrong. The real one lived in India, wrote it down in exacting detail, and his method is still used in operating rooms today. Historians still argue about exactly when Sushruta lived. Some say the 6th century before the Common Era. Some place him centuries later. What isn't in dispute is what he left behind. A written medical textbook precise enough that it reads like a manual, not a myth. Kashi, on the banks of the Ganges. Even then, an old city, a center of learning that pulled in students from across the subcontinent. Somewhere along this river, Sushruta ran a school that trained physicians, not priests. Tradition holds that Sushruta trained under Devadasa, a physician king of Kashi, learning medicine the way any serious craft was learned then, sitting beside a master, watching, repeating, failing, and doing it again. Before any student touched a real patient, Sushruta made them train for years, 6 at minimum. Incisions cut into watermelons and cucumbers, stitches sewn into leather and animal hide. For the nose graft specifically, students rehearsed the exact motions on leaves and shaped clay long before a blade ever touched real skin. Ancient Indian medicine had already split itself into 8 branches, covering everything from child health to toxicology. Sushruta claimed one completely, Shalya Tantra, the discipline of surgery, and he wrote it all into a single text, the Sushruta Samhita. Inside it, close to 120 surgical instruments, catalogued and named. Sharp blades called Shastra, blunt hooks and forceps called Yantra. His own rule, every instrument shaped after something in nature. A bird's beak, a crab's claw, a lion's tooth. One day a soldier is carried into the clinic. His nose is gone, cut away in battle, a wound common enough in this era that Sushruta already has a method waiting. He studies the wound in silence, then asks for a fresh leaf. He lays the leaf against the soldier's face and cuts it down to the size and shape of the wound, using it as a template. A precise pattern cut from a plant, about to be copied in human skin. Sushruta cuts a matching flap of living skin from the soldier's cheek, careful to leave one edge attached so blood keeps feeding the tissue. He twists it into place over the wound and stitches fast in short, exact motions, packing the wound with oil-soaked cotton when he's done. Lie still. Do not strain. Do not sneeze. Over the following days, the flap takes root, fed by its own blood supply, and slowly becomes part of the soldier's face. He walks out with a nose again, and Sushruta writes the method down for every student who comes after him. Not every patient needs a graft. A man goes blind from clouded eyes, and Sushruta performs a procedure called couching, a curved needle inserted at a precise angle beside the cornea, pushing the clouded lens out of the line of sight. Then the moment every patient waits for, when he can suddenly make out light and shape again. Sushruta documents cesarean delivery for births that threaten the mother's life. He documents cutting into a patient's bladder to remove a stone, entering through a single precise incision that avoids the intestines. Knowledge built by dissecting cadavers, soaking bodies in slow-moving river water to study what lies underneath, layer by layer. For centuries, the Samhita is copied and studied by physicians who never meet Sushruta himself. His students refine the graft further, moving it from the cheek to the forehead. His name becomes shorthand for surgery itself, across a subcontinent that never stops using his methods. In 1792, a bullock cart driver named Cowasjee is captured by Tipu Sultan's soldiers at Srirangapatna. His nose and one hand are cut off as punishment for serving the British. A year later, near Pune, a craftsman rebuilds his nose using a forehead graft. The same lineage of technique watched by two stunned English doctors. In 1794, the account is published, first in a Madras newspaper, then in a London magazine. Europe treats it as a discovery. It wasn't one. Today, surgeons still call the graft the Indian method. Sushruta is recognized as the first named surgeon in recorded history, cited in textbooks that once left him out entirely. Two statues stand for him now. A marble Sushruta inside the Royal Australasian College of Surgeons in Melbourne, donated in 2018 by a heart surgeon who performed India's first coronary bypass, and a bronze Sushruta cast in Tamil Nadu, unveiled inside the Royal College of Surgeons of Edinburgh. No microscope, no antibiotics, just anatomy learned by hand. Written down 2000 years ago, now standing in two surgical colleges on opposite sides of the world from where he actually worked.